Hello everyone, good morning. This is Dr. Hawk again, live every Saturday. It's 10 o'clock, but it's a little bit more than 10 o'clock, but I planned to be 10 o'clock, but I couldn't make it. I'm so sorry about it. But I promise I'll try to come every day 10 o'clock in the morning. My clinic is open Saturday as well, but Saturday our patient I schedule for the patient like afternoon. So in the morning time, I try to take some time for you and come to the live. So I got a lot of questions throughout the week from you guys regarding your health, regarding your different types of disease, different the food, but I cannot answer all the questions. But I selected few questions that many people asking same question. So I'll be happy to answer them. And please write your question in the comment section. I'll be happy to read and reply. And let me know your concern. So the first question that I have is from Miss Emmanuel. Miss Emmanuel, you said you have a bad breath. Bad breath and discomfort. So Miss Emmanuel, bad breath could be many reasons. It could be some minor infection in your throat area. That could be my number one reason. And infection, when it comes to throat, you have to understand that this is coming from the tummy. So our body, very interesting process, and it's a huge, very complex process of digestion, right? When you eat the food, come to esophagus, come to the tummy, and intestine absorb the food as a nutrient, give it to liver supply throughout the body, right? So why you have a bad breath then? It coming from the food you're eating. And how it is, when you're eating the food is not being processed properly. It comes to intestinal bacteria overgrowing. When intestinal bacteria overgrow, that makes your tummy also gets some bad bugs, candida, yeast, parasite, fungus. It could be many names. And then it goes through all the way, come to esophagus, it come to the throat, and you get a bad breath. Okay, that's primarily. That could be any other reason you have a long-term infection. You can check it out. So you have to get rid of candida, you have to get rid of indigestion, you have to get rid of fungal overgrowth in the body. And unfortunately nowadays, very young folks, I see fungal overgrowth. That's kind of sad that people overgrow fungus in the early age. And I saw a young boy, 9 years old, happened to be yesterday, I saw him. He came to the clinic. He has a eczema throughout the neck and this area. So this is like that kind of eczema, when you have grow eczema or kind of things in your body, that actually extreme overgrowth of bacteria in the tummy that shows in the outside of the body. So sometimes people have pimples, right? That's also a sign that you have bacterial overgrowth. So Ms. Sandoval, I hope you got your answer. Now I'm going to go to the next question that I'll read questions in a minute. Let me see the other questions. So the next question that we have is, when you have a diarrhea, Mr. Jason wrote that he got diarrhea last few months, and whatever he eats goes out of his body, and he cannot digest anything. He feels very fatigued and weak throughout the day. And Mr. Jason, for you, when you feeling very fatigued, that means your adrenal gland that you have above the kidney, your adrenal gland is wear out. So adrenal gland is not functioning properly, it's underworking or overworking. So when you have the adrenal gland underworking, then you feel fatigue and you feel weak, you don't feel energetic, right? So in that case, you have to give enough healthy diet so that you feel you get energy. And healthy diet is not enough for you. You have to have some probiotic with it. You have to have some digestive enzyme with that. So get some digestive enzyme, get some probiotic, and if you think you have pain in the intestinal area, you have discomfort in the pain intestinal area, that means you have some chronic infection too. So this kind of chronic infection is not enough with the probiotic. Mr. Jason, for you, first of all, you have to be probiotic and enzyme, I said. Then you have to get a anti-candida, anti-fungal diet, which is sugar-free and healthy diet with a lot of cooked plant-based food. That be your diet. And one more thing, don't forget to do one more thing, which is intermittent fasting. Fasting will help you to regenerate your enzyme, to regenerate your bacterial profile, to regenerate your body, to digest the food, so you won't feel diarrhea all the time. So that's actually not uncommon though. We get a lot of patients that indigestion, that lose motion and diarrhea, cannot digest anything, and fatigue. Fatigue is a most common patient we see nowadays. So people eating, they get fatigue. People eating, they get tired and dizzy. So why? You need to take care of your body. What are the root causes of your health issue? Then you can take care of your fatigue by taking magic pill or Gatorade or electrolytes water. That is not a solution. Maybe that will feel you better for a few minutes, but long term you have to see what are the underlying root cause that making you fatigue, weak, diarrhea, and stomach discomfort and infections. So the next question that I have is pain in the chest. So Miss Ruiz, she wrote that she has a pain in the left side. So Miss Ruiz, for you, a lot of people think that if you have a pain in the left side, that means this is a heart issue. You have a block in here, which is not. So pain could be anywhere in the body. Don't guess anything that, I have this disease, that disease, I have a block, I have a heart attack. It's not that. If you have pain anywhere in the left side, it could be from your lung. It could be you might have a lung infection. It could be mild, it could be severe. So left side infection not always has to be with your heart. Heart, I know you thinking about that we have a heart issue. Heart issue only you have in the middle, right? In the middle, you feel a lot of pressure. You feel a lot of breathing problem. Then you think about that, maybe you have a heart issue. Until otherwise, you do not think about excess that you might have. You don't think about that you might have heart issue. And heart issue, the number one and only, and the best way to judge you have a heart issue is when you run and walk, how pressure you feel, how shortness of breath you feel, and you feel very weak when you start running and walking. And then you feel that you might have a heart issue. Remember, if you have a heart issue, make sure you have to walk and run and cardio exercise. But if you have a severe heart issue, you don't want to walk and jog and cardio too much, as much you can bear. If you cannot bear it, don't do that, right? And so you should be fine. Just take care of your lung. Taking care of your lung, you get a free oxygen, fresh air. You need to get a ginger tea. You need to get a food that not being processed. Whole food, plant-based diet helps clean the lung. And of course, green tea will help you. Also, sleep well, and sleep well, clean your room properly. Make sure there is no mold growing in the house. When you have mold growing in the house, that is going to be very harmful for your lung, okay? And the next question, I have a lot of questions in that comment section. I'm going to come and answer your question. Saddam Hussain say, Assalamu alaikum, how are you? I'm doing great. I'm in the clinic, so I'm waiting to see my patient. Of course, I'm doing great. I'm looking forward to help some people. And this is the time I talk to the live every Saturday. So I'm feeling glad and I'm happy to be here right now and to talk to you guys. Huma Hussain asking, does probiotic help with acidity? So this is a very important question. Probiotic help with acidity. Remember, probiotic help, but the acidity have a long causes, right? Long term, it has developed the acidity. So to resolve the acid problem, to reverse the acid reflux or gastritis, it's not only that you take probiotic. You have to look at the root cause. What caused this acidity? You have to fix that problem. Uh, so you have to fix that problem. Then you can add probiotic, or you can add probiotic right away. You have acid problem, you definitely have a depleted bacterial profile. You have to have a probiotic, but that's not enough. That only support. So for acid reflux, I spoke in different live. For acid reflux, you have to look at the root cause. What the root cause? Root cause is when acid level depletes in the stomach below like acid reflux heat like pH, because acid level you can measure by pH. If pH become over 3, then the sphincter, the mouth of the stomach, which is cardiac sphincter, get loosened up and acid comes out through esophagus to your mouth, and you feel burning sensation and you feel acid reflux. That's the problem, right? So it's not enough probiotic, as I said. So you have to look at the root cause. Root cause of acid reflux is you depleted your acid layer. So then what is the solution? Simple. Put acid back. So the first thing you can do, always have some acid with your food, like apple cider vinegar, lemon, some ginger before meal, some olive, add some like a red berries, add these kind of things will help you to boost up your acid level. Also, you need to do is when you eat the food, you have to chew properly. When you eat the food, you have to make sure that you're chewing like minimum 40 times, and you keep chewing and keep chewing, make it like liquid, and then it easily to swallow, and it's not gonna stop in your tummy. And a lot of time we just put in mouth and swallow. Remember, digestion starts from here. If you don't digest from your mouth, it's not going to be digested completely when it goes to stomach, because digestion has to be started from here. So chew properly and do not drink water with the food. We have a habit that we have in dining table, have our meal, have a glass of water with it. No, drink water throughout the day between the 2 meals. When you have a meal, don't drink water, because that dilute the stomach acid, that dilute the enzyme, that inactivate your enzyme who's supposed to be digesting your food. So one more thing you could do for acid reflux, I mentioned in my previous live, is movement, because digestion is not only chemically, it goes mechanically too. When you eat the food, your esophagus compressed, it pump, your stomach also pump. So digestion also need to be mechanical process. On that mechanical process, you need healthy movement. So always make your body cell active. Body, stomach, and esophagus, whole digestion system should be active. How could you do that? Make sure you get rid of inflammation, get rid of protein reaction. So always have a healthy movement. Sitting in the table, sleeping, and going to the office, you have to get out of this habit. You have to have a certain time. You go healthy movement, walking, running, sports, or cardio. Then body is ready to digest chemically, mechanically as well. So both you have to get ready to digest your food. If you can improve your digestion, improve your acid level, add probiotic, that's the perfect way you can boost up your digestion. That's a perfect way you can get rid of acid problem. Okay, I hope you got your answer. So let me read some questions. Someone asked me how I'm doing. I'm doing great, again, because I'm in the clinic. Someone wrote from India. Salam, doctor. Walaikum salam. Hope you are fine. How are you doing? You are doing great social work. Yes, helping people is a great thing. We doctor, we help people. So of course, this is social work. And Huma Hussain said that I didn't chew your food properly. I got into the habit of not chewing. Thank you very much for your advice. Yes, this is our habit. This is a very common habit that we eat food without chewing. We put the food mouth and swallow it, and then drink a lot of water. A lot of people I know I see say, "Doctor, I couldn't swallow the food properly." I said, "Why?" Because imagine that person did not drink water throughout the day. Whole body get dehydrated, and body doesn't have enough fluid to put your food into the stomach, right? So make sure you drink a lot of water, so the cell in the esophagus and mouth and stomach get enough loosen up, enough hydrated, so that you eat the food can be going easily. So chew the food properly. Also drink water between the meal, not with the meal. Another big mistake people do is they start taking medicine like a protein pump inhibitor or antacid. Remember, that is dangerous. I get a lot of patients say, "Doctor, I got a lot of acid in my stomach." I said, "How do you know?" I say, "I feel it, it's coming out." And some patients say, "How do you know that you have a lot of acid?" They say, "My doctor told me." So answer is, coming out acid doesn't mean that you have a lot of acid in your stomach. Coming out acid, it means that you have lack of acid, and because lack of acid, cardiac sphincter in the tummy get loosened up, then acid comes out in the mouth and you feel burning sensation. So improve acid, and then cardiac sphincter gonna be mouth door gonna be tight and closed, nice and closed. Then you won't feel any burning sensation. And if you keep your acid level high, your digestion will be going well. You'll be able to absorb the food. You'll be able to stop growing bad bacteria. Remember, human body have 100 trillion bacteria to 600 trillion, and out of them, 30% are bad bacteria. If you feed them, they're gonna overgrow. If they overgrow, they're making all types of health problems. So bacterial health and digestive enzyme, how you eat proper food properly, how you maintain healthy lifestyle, that's the key of being healthy. And when you see our patient, we help our patient first what to eat, how to eat, what is the lifestyle, how to maintain good enzyme level, how to maintain bacterial profile, and then we give functional medicine based on what kind of health issue you have. Someone maybe have a underlying, but maybe adrenal is underworking, maybe thyroid is underworking, maybe someone have a lung infection, maybe someone have a leaky gut. So based on the malfunctioning of the body organ, we give functional medicine to support the body, so body function better with the support of healthy lifestyle and nutrition, and also to detox our patients. And then no matter how many diseases that they have, what kind of health issue you have, they get rid of all kind of health problem. They feel better. They don't need to continue medicine for their whole life. That's a true treatment, I believe, and people appreciate that. And that's why in integrative medicine approach, we doctors, we never fail, because we don't treat only simple disease, or we don't simple giving medicine and managing the disease. We support the root cause, and that helps you get rid of disease completely and permanently, and you can restore your health forever. So I'll take one more questions. I have many questions I cannot answer right now, but I promise I'll answer in next Saturday session. Please send me your questions. I'll be happy to reply in next Saturday session. I'm going to take one more question. Mr. Isaac wrote, "How can I consult with the telephone or any email?" So if you like to consult with me, again, I want you to follow my videos, follow my articles. That would be enough for you to be healthy and to get perfect health. But I always say that if you are very difficult patients, you have so many underlying health issue, then you talk to me. Then you try to schedule. Then you make a schedule with me, because I don't have opening schedule for non-clinical patients, and I do give advice on the phone, on the live, and I'm telling everything what I know. I'm telling everything, complete solution that you have a health problem and you are writing to me. So I'll try to give all my advice on the live completely. And but if anybody have a very difficult issue, chronic diabetes, long time chronic disease like diabetes, heart disease, cancer, autoimmune disease, or long time infection, or allergy never goes away, this kind of severe and difficult patient, please, you can schedule. You can call in our clinic number. I'm going to write down in the clinic number right in here, 713-234-1014. You can call anytime to the clinic. They'll schedule for you, or you can write a message in the inbox, page inbox. They will schedule, they will reply, and they'll schedule with me. If you're not in Houston, you can meet with me over the video consultation. Okay. Thank you very much. And I hope you're all doing great, and stay well. Let me know if you have any question. I'll be glad to answer you in a live next session. And until that, stay well and wish all the best of the world luck for you. Thank you very much.